This is Dr. Caroline Peterson in Natural Women's Health Institute in Sarasota, Florida. Today I'm talking about the uterine ligaments. This is your uterus. The top part of it is called the fundus, and the fallopian tubes come out of that into the little hands that reach for the ovaries. Then you go down the fundus in the uterus and to the body, and then the lower part is called the cervix, and that's the part that's in the vagina. Um, Inside of the uterus, you have the endometrium that is shed every month during your reproductive years if you are not pregnant and if you are having a normal reproductive cycle without hormonal intervention and other types of issues. So that's your uterus. But she doesn't just hang out there by herself. She actually has a support system. So this support system is called ligaments, but it's not really like the other ligaments that we think of, which are the ligaments that go between bones and create joints. These ligaments are really not strong in the same way. They're not made of the same things. They're more like the connective tissue that organizes the intestines, called the mesentery. And the ligaments, the uterine ligaments, the ligaments that support the uterus, do have collagen, like the other ligaments in the joints, the bones. But they also have blood and lymphatic vessels. They have nerves. They have fat tissue. They have another type of connective tissue, and then they have muscle. And this is important because, of course, with pregnancy, they stretch. And then it takes about 6 months for them to come back to their non-gravid state. And so having smooth muscle in the ligament is something that we don't see in the ligaments of the bones. Some of the nerves that are in the ligaments, the uterine ligaments, are the pelvic splanchnic nerve and the inferior hypogastric plexus. So what this means is that the ligaments themselves are going to have an impact on the organs of the pelvis and the autonomic nervous system. So the ligaments themselves of the uterus can influence how well your bladder is emptying, how well the rectum can move fecal matter through, and how well you're able to have an erection and orgasm and enjoy sex. So these are the nerves that are involved in the uterine ligaments. This is the sacrum. So this is like you're chopped in half through your belly button, and we're looking down towards your feet. So we're looking this part here, that's the sacrum. And this part here is the pelvis. So the sacrum is the back part of the pelvis. The front part of the pelvis is the pubic bone or the pubic symphysis. Here's the disc that goes between the two sides of the front of the pelvis. So in the front of the pelvis, the first organ that we have is the bladder, and then we have the cervix, and then behind that we have the rectum, and then the sacrum is behind the rectum. So you can see in this picture, the left inferior hypogastric plexus is part of what is caught up and involved in the uterine ligaments. And here it is right there on the sacrum behind the rectum. We also have the pelvic splanchnic nerves, which are right here a little bit higher than the inferior hypogastric nerves. So the inferior hypogastric nerves are kind of like an extension of the pelvic splanchnic nerve, and the hypogastric plexus will split out and go on either side pretty much of the pelvis. So here are some of the cervical ligaments. So the cervix is the is the lower part of the uterus. And so if you get a pap smear, that's where they're taking the cells from. That's the part that has to dilate so that your baby can come out. So here's the pelvis again, the big round thing. And then in the front, we have the bladder, the cervix, the rectum, and the sacrum behind it. So the 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 thing that hooks the cervix to the front of the pelvis is called the pubocervical ligament. Most things in the body, like ligaments, are named for where they originated, where they insert. Makes it easy. So pubo means pubic bone is where it starts, and then it inserts onto the cervix. The next one we have is the cardinal ligament that goes between the cervix and the side walls of the pelvis. And here it's called the transversal cervical ligament, but that's not what it's usually called. It's usually called cardinal ligament. And then the last one, the uterosacral ligament, well, you can guess. It goes from the cervix, from the uterus, around the rectum to insert onto the sacrum in general. So that's looking down through your belly button to your feet on the left here. So now if we take a slice through the going from the top to the bottom of your head and body between your eyes, slicing down through the sagittal suture in your head, this is what we'll see over here on the right. So in the back, we have the sacrum, then we have the rectum, then we have the uterus and the cervix, the bladder in front with the uterine fundus leaning over, and then the pubic bone. So you can see the pubocervical ligament is here. It's going to attach between the uterus, the cervix, and the pubic bone. We also can see the uterosacral ligament that goes between the uterus and the sacrum in this picture. Now, this is another picture. Look, let's say we cut you in half at the belly button and are looking down towards your feet. So this is the top of the pelvis, the sacrum and the side walls of the pelvis, the front of the pelvis. So in the back, we have the rectum, the uterus, and then the bladder. So the uterus is here in the middle, and towards the back, you have the fallopian tubes reaching out to the ovaries. And then these other arms that come off are the round ligaments. And then we can see here another picture of the cardinal ligament going to the side wall of the pelvis, the uterosacral ligament going from the uterus back to the sacrum, and then the pubocervical ligament going from the uterus to the front of the pelvis. This is another picture of the round ligament. This is not, this picture, this canal of Nuck, it's not something that everyone has. It's just a congenital anomaly, but it's very hard to find pictures that show how the round ligament goes through the inguinal ring into the labia. So this is the round ligament originates in the labia and then inserts up here on the uterus. And so a lot of people don't know that. So I wanted to find a picture that kind of showed that, and this was the best I could do. The other major ligament of the uterus is called the broad ligament. And that's basically like a sheath that goes over the front of the uterus and then hooks onto the side walls of the pelvis. So you can see a lot of the other ligaments are kind of like covered by it, but it's the one. Here's the broad ligament of the uterus. It includes the part that hooks the fallopian tube to the ovary, and the part that it goes from the body of the uterus to the side wall of the pelvis, and between the ovary and the side wall of the pelvis. So this whole thing is like a wing that stabilizes the uterus and the ovary and all of the other uterine ligaments. So the ligaments that are most associated with prolapse are called the apical ligaments. And they're not only important for stabilizing the uterus in its place, but also for stabilizing the anterior wall of the vagina, which is related to bladder prolapse or cystocele, and the posterior wall, which is related to rectocele. So primarily related to the uterus and the anterior wall. To a lesser degree, the apical uterine ligaments are related to the posterior wall. The major apical uterine ligaments are the cardinal ligaments and the uterosacral ligament. The pubocervical ligament is also one of the apical ligaments, but is not as influential as the others. So here again, we're looking like we're cut through the belly button and looking down at the feet. This is going to be the rectum. Here's the cervix, and here's the bladder. And so we have the cardinal ligament that goes between the cervix and the side wall of the pelvis. And we have the uterosacral ligament that goes between the cervix and the sacrum behind the rectum. The cardinal ligament is like a web. So this is part of the way that the uterine ligaments are different than the ligaments of the spine or other joints. This cardinal ligament is like a web, and it originates in the anterior part of the internal iliac artery and the upper part of the sciatic foramina. The insertion is on the cervix and the upper third of the vagina, and a third of the fibers go to the bladder. So this is one way that it's like a web. The uterosacral ligament is more like a band, but not like a strong band like you would find in the ligaments that go between the bones. In 63% of people, the uterosacral ligament originates both in the cervix and the vagina. So that's most people. 33%, it originates only in the cervix. And in 4%, it originates only in the vagina. The insertion of the uterosacral ligament is mostly on the sacrospinous ligament and the coccygeal muscle, which is kind of funny, right? Because it's called the uterosacral ligament. But it only inserts onto the sacrum in 7% of the people. So the sacrospinous ligament and coccygeus muscles are very close to the sacrum, but they would be considered soft tissue instead of bone. So this is more flexibility. 11% of the people will have their uterosacral ligament insert onto the piriformis, the sciatic foramen, and the ischial spine. So here we are again. Here's the cervix. The cardinal ligaments going mainly, they go to the side wall. They may originate in the cervix and the vagina, just the cervix, or just the vagina. Then we have the uterosacral ligament that mostly doesn't insert into the sacrum. It can, but it also inserts into the structures that are close to the sacrum. So here's another little picture of the uterus. This is the posterior pelvis, where we have the rectum, the sigmoid colon, the descending colon, and then the ovary. And here we have a picture of the cecum on the other side of the uterus. Oh, wait, that's the rectum. Here's the uterus right here. So showing the relationship of the uterus to the bladder, to the rectum, to the cecum, which is part of the large intestine, and to the sigmoid colon. So everything is like squeezed in there. So when I'm working with the uterus, I am not only working with the uterus. So this, some people will want to order up, you know, work with my uterus, just treat my uterus. Well, for me, that's not really possible because the uterus lives in this matrix. And so you have to figure out, what's involved in the uterine position and the function of the ligaments and vascularization and so forth. So you really can't just do anything in isolation because it's a system. And so when I work with the uterus, I want to actually not start with the uterus mostly. Generally, I'll start with other things that surround it. So if the kidneys are not in their proper position, I will generally start with the kidneys because they don't belong in that neighborhood of the uterus. And so we need to get the kidneys back to where they belong. We need to get the the cecum and the sigmoid colon moving properly. They can get kind of like adhesed and caught up, tangled up with the uterus. And then the ovaries, if they're not moving properly, I will work with them first because the uterus will always, the fallopian tubes will always follow the ovaries, not only because of the broad ligament, but also just because of the psyche of the uterus wanting to be with the ovaries. So we have to reform, we have to optimize all these things first and listen to the body to guide us to where the pull is, where the hold is, and work with that. And then when we're working with the uterus, we're not only working with the body of the uterus, but we're working with the particular ligaments, the veins, the arteries, the lymphatic vessels. So because all these things are part of her neighborhood, these are the things that surround her and that create her quality of life. And then, of course, we'll work with the interface of the bladder's in front of the uterus. So they have an interface that has to be moving. If that's sticky, if there's a history of inflammation or infection, they can get stuck on each other and not move properly. Same with the rectum. The uterus also is like laying on or touching, interfacing the rectum. So if with that infection, inflammation, constipation, diarrhea, any kind of GI thing, you can get stickiness there too, and that has to be taken care of. So I usually start by working on the tummy, and then once we have things moving more or less, then we do refinement by doing the intrapelvic care. And so that's going to be working with the cervix, the bladder, the posterior wall of the bladder, the rectum. This is where we're able to have an impact on prolapse also, and draining the pelvis, working with the muscles and the joints of the pelvis. And then also I include adjusting because if the sacrum is twisted and that's primary, then you're going to have a uterus that never goes back into position. If the uterus is twisted, it will pull on the sacrum. So you have to listen and you have to recognize what's primary and what's secondary so that you can get a full balancing and resolution. So that's the way that I work with the uterus and the surrounding tissues to try to stabilize and optimize function.